It can feel like heartburn, but acid reflux can lead to a much more serious condition.
Health specialist Denise Tador joins us now with a report on a new type of reflux and how doctors are able to treat it.
We're identifying it and treating it right away. Well, sometimes the symptoms of acid reflux disease feel like heartburn. Sometimes it just feels like pressure above the stomach. It's a disease that doctors can diagnose and usually treat effectively. But now there's a new kind of reflux disease popping up, and there's been no way to diagnose it until now.
2 years ago, Sylvia Gustafsson's life changed forever. While working as a nurse at a hospital, a patient strangled her.
Oh, I lost my voice within the hour.
The massive throat injury damaged her esophagus, lungs, and vocal cords. Her voice is now a whisper, amplified by a voice box.
But I still feel grateful that I still got a little voice.
Sylvia also started having asthma symptoms. Dr. Donald Castell is seeing these unusual symptoms in people on medication for acid reflux disease.
It's a phenomenon that's occurred because of all the drugs that are out there now that control acid so well. They'll stop the acid, but they don't stop the reflux.
It's called non-acid reflux. It can cause chronic cough, asthma, indigestion, and nausea, symptoms not typically linked with acid reflux disease.
If we can detect it, then we're going to have a much better chance of treating it.
Typical monitors depend on acid as a signal to detect acid reflux disease. Now, this new monitor can detect reflux when there's no acid present by measuring electrical resistance in the esophagus.
It's a huge step forward.
When patients learn reflux is the problem, they can have surgery to fix it. Dr. Castell thought non-acid reflux might be causing Sylvia's asthma symptoms. She wore the new monitor for 24 hours.
It showed 144 reflux episodes, and the normal is below 40.
She had surgery, and her reflux is gone. She's still fighting her way back to a normal life, but she's optimistic.
I think you need to be just thankful for what you have.
And in one study, non-acid reflux disease was found to be the culprit in 26% of patients who had a chronic cough. Once it's found, doctors say treatment works. And in another study, every one of the patients with chronic cough caused by reflux was cured of that cough after surgery.